This is a paid advertisement.
Welcome back to The Noon Show and welcome to Ask the Expert on WBAY TV2. Our expert today is Dr. Patel from Tower Clock Eye Center. And Doctor, you're known for so many things at Tower Clock Eye Center, not the least of which is your work with cataracts. And we throw the word around kind of casually sometimes, but medically speaking, what is a cataract?
So cataract is actually the clouding of the natural lens that's within our eye. So at birth, we all have a lens that's in the eye that helps us to focus, and that lens is typically clear. Over time, the proteins in the lens start to change, and it can become cloudy, which can interfere with vision.
So when you say over time, is there kind of a blueprint to it? At what point people start to experience cataracts?
Every person will be a little bit different, but typically around the age of 60, people have cataracts. Some people are having symptoms from the cataracts and get it removed at that time. Some people wait for maybe another 5 or 10 years beyond that because they're not having any issues.
When do you know that it's time to come see you at Tower Clock and deal with a cataract? Is there a specific symptom or is there something that's happening to everybody where you go, oh, now's the time?
Well, typically we like to think of cataracts as something that we fix when it's interfering with the things that you like to do. So if you're having trouble with reading, having trouble with watching TV or driving, those are the times when we might say it's time to get surgery done.
I think we make excuses a lot of times in life and we overlook a lot of those symptoms, but it can become very hazardous, especially at nighttime, for example. Is that when many people notice it?
Yeah, that's one of the most common things that I hear is that people are having trouble with night driving, especially when there's oncoming traffic and headlights from cars from across the road. And so if you're having trouble with that and you want to be able to drive better at night, then it's probably time to have something done.
Once you've determined that surgery is the avenue, I think that can be a scary thing for folks, especially because you get one set of eyes. But it's very common, and there are different options for the patient as well, right?
There are a lot of different options. So as far as cataract surgery goes, this is a surgery that's been done successfully for decades. We are fortunate to be able to have access to the latest and greatest technology. So we also offer laser cataract surgery as well as lots of different lens options.
Could this actually help me get out of glasses if I'm a patient?
Oh, absolutely. For the right candidate, we're able to take some measurements and help to pick a lens which can get you good distance vision without glasses or good near vision without glasses, and in many cases get you good distance and near vision without glasses.
I've heard the term secondary cataract. Does that mean that it comes back and I'll have to come see you again?
Oh no, once the cataracts are done, they're gone. But sometimes people can get a secondary cataract, which refers to a wrinkling or scar tissue that is happening on the tissue behind the lens. And if that does happen, it's a quick 1-minute laser to go ahead and get that cleared up.
Excellent. If you're experiencing any issues with your vision, contact the folks at Tower Clock Eye Center today. Contact Dr. Patel or anybody who answers the phone. They're going to be able to help you out. And that information is right there on your screen. We'll get you back to the Noon Show right after this.
The preceding was a paid advertisement.